I'm Stacy Daly. I'm a licensed mental health clinician with over 10 years of experience. I have credentialings in substance abuse and other addictions, as well as specialties working with families and those on the spectrum. I am close to ending a 2-year project where I will be certified as an eating disorder specialist, and that includes testing, coursework, collaboration, and direct hours. Eating disorders are a complex mental health condition. There are many different kinds of eating disorders: anorexia, bulimia, ARFID, OSFED, and binge eating disorder are a few. Many misconceptions surrounding eating disorders is that it's all about the food, and it's really more than just food. Some people that have eating disorders will hear just eat more or just eat less. Truly, when people meet criteria for an eating disorder, they are experiencing some severe restrictive techniques, some paranoid thinking about the food, what the food might cost them. Anxiety and depression can be very intense for those that have an eating disorder. Common factors that might lead somebody to a diagnosis of an eating disorder can include genetics, can include the society that they're living in and the norms around body image and food. It can include trauma. It can include any one or more of these factors. Something that's very important to me is to serve those that are just ordinary people that are experiencing some things that are not ordinary. A lot of times people will begin an action that does serve them really well. Maybe they're grieving, and this is where they start to exercise more to handle the grief, and then as time goes on, they actually develop a rigidity around that can put them at risk for developing an eating disorder. Some signs that someone may be struggling could be over-exercising, restricting food, or trying to manage their shape. When you show up at group here at Stewart Memorial, you're going to feel a part of something bigger than yourself. You're not all alone, and you're going to get that warm connection. Something that group offers that is unique is the connection with peers. People enjoy being able to connect. Even if their eating disorder is different, there's enough similarities that they connect with each other. Another component of group is what I call an education component, and this is about learning how to manage some of those really intense emotions that could be surrounding food. People learn how to call somebody and sit with them while they eat, healthy distractions, playing a game during eating, planning out before, during, and after a meal, and what that looks like is a good coping strategy. Sometimes it's hard for people to come to group, but you as a family member and friends and teachers, that you guys can be the supporters at home that help them to feel like it's a good idea and that you understand that they need to take advantage of these resources here at Stewart Memorial. It can seem a little daunting and scary as a loved one or as a person who may be struggling. I want you to know that I am committed to genuine, valuable, quality care. If you or someone you know is struggling, feel free to reach out to me personally here at Stewart Memorial, or contact your primary care physician to get more information. If you already are diagnosed with an eating disorder and you have a therapist and a primary care physician, you can still join our group.
Choose excellence, choose Stewart Memorial.